Do you have high blood pressure? Or are you worried you may have a risk factor for it? Here we will go over the causes of high blood pressure so we can all live healthier and fuller lives. High blood pressure, also called hypertension, is a major issue leading to heart disease, brain diseases including stroke, and ends up affecting everything from the eyes to the kidneys. Approximately 76.4 million Americans over the age of 20 years have hypertension. That roughly comes to 30% of the population. And only half of those being treated have it under control. And as many as 8% have undiagnosed hypertension. The cause is not known in most cases, or at least it is not known to be caused by a known medical condition. This is called essential hypertension or primary hypertension. In some cases, high blood pressure is caused by some other medical condition. This is called secondary hypertension. Okay, so talking about primary hypertension first. The precise cause is not well understood. However, a number of risk factors are strongly and uniquely associated with its development. Now, with this primary hypertension, you could have avoidable and unavoidable causes. Now, listen closely and see if anything relates with ourselves. So, going over the avoidable causes first. Number 1. Excessive sodium intake, or more than 3 grams per day of salt, increases the risk of hypertension. And controlling salt in your diet lowers blood pressure. Always check the sodium content of your food. Keep on looking at those labels. So a high sodium diet is to be avoided. Number 2, excessive alcohol intake can lead to the development of hypertension. For a man, that is more than 2 drinks per day, and for a female, it's more than a drink per day. So let's keep alcohol consumption to a minimum. Number 3, a sedentary lifestyle increases the risk of hypertension, and exercise is a great way to lower blood pressure. So keep moving and stay active. Next is number 4, obesity. Now, obesity and being overweight are huge risk factors for hypertension. And this is something that we can surely work on. So this goes hand in hand with staying active. So does any of this relate with ourselves? Let's note it down and try to make it better. Now for the possibly unavoidable causes of hypertension. Age. Advancing age is associated with increased blood pressure, in particular the systolic blood pressure, in subjects who have 1 or 2 hypertensive parents. Racial background. Now, hypertension tends to be more common, more severe, comes on earlier in life, and causes more complications for African Americans and people from the Indian subcontinent. Next comes diabetes and cholesterol problems. The presence of other medical problems, including diabetes and high cholesterol, appear to be associated with increased risk of developing hypertension. Next is personality traits and depression. Hypertension may be more common in those individuals with certain personality traits: aggressive nature, hostile attitudes, time impatience, as well as among those with depression. Next, what happened to us when we were not even born is also out of our control. In your mother's womb, if there were oxygen problems or poor nutrition, premature birth, and also issues after birth such as infections or poor diet, all can affect you. So these were the primary causes. Now the secondary causes of hypertension are medical problems that may increase our blood pressure and thus cause hypertension or secondary hypertension. On many occasions, a lot of different risk factors for primary hypertension may mix with secondary causes, and that may end up making the diagnosis and treatments much more complicated. But these causes are sometimes also avoidable and potentially reversible. Prescription or over-the-counter medications. Oral contraceptives, especially those containing estrogen, can lead to hypertension. But of course, it doesn't mean that it will happen if you take such. But if you do have an issue with higher blood pressure, tell your doctor all the details of what you take at home. Over-the-counter medication containing ibuprofen or similar drugs can cause high blood pressure. Drugs that open up the nasal passages, such as pseudoephedrine, can cause hypertension. A lot of medication for the treatment of depression can lead to high blood pressure. Steroids, certain weight loss medications can also be the culprits. So always keep your doctor in the loop. Stimulants, including amphetamines, can cause hypertension. Illicit drug use, drugs such as methamphetamines and cocaine can raise your blood pressure. So again, always be honest if you do have a blood pressure issue and tell your doctor everything. Kidney diseases can lead to hypertension, and there are many kidney diseases that can cause high blood pressure. If you have a specific medical condition called sleep apnea, then this could be causing your hypertension. This is when you suffer from lack of oxygen when you sleep. Other hormonal problems like thyroid issues can cause high blood pressure. Whatever the case, physicians on their part should always try to promote a healthy lifestyle and prevent hypertension and encourage better hypertension control for patients. Agreed that it may not be easy. And a comprehensive approach to hypertension control includes identifying modifiable risk factors early and bringing in timely clinical interventions and lifestyle changes for all patients, regardless and irrespective of their level of risk or age. Our health should be most important to us. Now, is there anything we can do today to get us on the right track? I'll give you a moment to think about it. Yes, there always is, and I would love to hear what it is, so do mention that below in the comments and get working on it today, right now. To sum it up, sometimes there are causes of high blood pressure which we can work on ourselves, such as a healthy diet and exercise, avoiding much alcohol, and keeping track of even those over-the-counter medications can go a long way in figuring out the cause of hypertension. Anyways, click on the subscribe button and get the latest info on health-related topics, and do share your experiences and thoughts. We would love to hear your story. And always keep in mind that your doctor's goal is to prevent you from taking medication. But if you have to, you must take them properly. My friends, stay healthy and stay safe.